One moment. Okay, hi everyone. Like Toya said, thank you for the introduction. My name is Savannah, and I also have Vinny here with me. Our presentation is the what you need to know about cardiovascular disease. So let's get started. Here's us, and yeah, nice to meet you all. Okay, so I'm just gonna start and talk about what is cardiovascular disease. I know we kind of like group a lot of heart diseases together, like hypertension and arrhythmias and everything. So cardiovascular disease is actually an overarching topic. It's a group of disorders of the heart and blood vessels. So these are examples of different types of cardiovascular disease. Here we have heart disease. So heart disease includes a numerous amount of problems. Many are related to something that we call atherosclerosis. So the heart and blood vessel disease includes atherosclerosis, and atherosclerosis is basically a condition that develops when a substance called plaque builds up in the walls of our arteries, and this buildup basically narrows the arteries and makes it harder for your blood to kind of like flow through. Um, and if a blood clot forms, it can actually uh, it causes a block in the blood flow, and this can lead to either heart attack or stroke. Um, and that kind of segues into a heart attack as one of the cardiovascular diseases. It's also, you may hear it called a myocardial infarction. So a heart attack occurs when the blood flow is part of the heart and it is blocked by a blood clot. It cuts off the blood flow completely. The part of the heart that makes the heart muscle, this part of the, sorry, the part of the heart muscle supplied by that artery begins to die, basically. And most people will survive their first heart attack and return to their normal lives. And they will enjoy many more years of productive activity. But experiencing a heart attack does mean that you need to make some changes, including medication and lifestyle changes. Um, and then in addition to clots, it can also cause a stroke. And a stroke is basically when the blood supply to the brain is reduced. And there are two different types of strokes, one that we call the ischemic stroke and one called the hemorrhagic stroke. So ischemic strokes are the most common type of stroke, and they occur when the blood vessel that feeds the brain gets blocked, usually from a blood clot. When the blood supply to a part of the brain is cut off, some brain cells will begin to die, and this can result in loss of functions um, controlled by that part of the brain. That's why you see, like, when people have a stroke, they may have some trouble walking afterwards or talking and slurring their words. And then the other type of stroke is called the hemorrhagic stroke, and it occurs when the blood vessel within the brain bursts. This is most often uh, caused by uncontrolled hypertension or high blood pressure. And then a different type of part of the cardiovascular diseases is heart failure. And the heart failure basically happens when the heart isn't pumping blood as well as it should be. You may also hear it called congestive heart failure. And it doesn't necessarily mean that the heart will stop beating. That's a common misconception. The heart it keeps working, but the body's need for blood and oxygen isn't being met. And then there's arrhythmias, and arrhythmias refer to an abnormal heart rhythm. And this could mean that it's going too fast, too slow, or it's just irregular. And arrhythmias can affect how well your heart works. With an irregular heartbeat, your heart may not be able to pump enough blood to meet your body's demands. And then finally, there's also heart valve problems. So the valves in the heart, there are two, and they don't open up enough to allow the blood to flow through. So that's just a quick intro on different types of cardiovascular disease. Let's see. So here I just wanted to introduce some key facts here. So cardiovascular diseases are actually the #1 cause of death globally. In the US, 1 in every 4 deaths is due to heart disease. Um, Globally, 17.9 million people in 2016 died from cardiovascular disease, and this represents 31% of all deaths. And over 3/4 of deaths took place in low and middle income countries. And finally, the cost. So heart disease is also very costly, especially in the US, about $219 billion each year from 2014 to 2015. And this includes the cost of healthcare services, medicines, and lost productivity due to death. Okay. So there are multiple risk factors that can lead to heart disease. There are some that we kind of categorize as non-modifiable. That means, we can't really change anything about it. It's just going to happen. It eventually happens to everyone. So that's including like older age, family history, maybe if the mother or father or grandparents also suffered from some type of heart disorder. And actually, males have a higher incidence of cardiovascular disease compared to women. And then we have the other category of risk factors that are modifiable, including smoking, alcohol consumption, poor diet, low exercise, obesity, poor sleep, and stress. And these are what we kind of consider somewhat modifiable. Some of them are not really, but they can be controlled. These are your comorbidities. So they're also underlying diseases that may contribute to cardiovascular disease. And an example of this would be diabetes. So there's type 1 and type 2 diabetes. Basically, your body needs glucose or sugar for energy, and insulin is the hormone made in the pancreas that helps move your glucose from the food you eat to your body's cells. And if you have diabetes, your body generally doesn't make enough of its own insulin, or as much as it should. Um, and then diabetes will cause the sugar to build up in the blood. And the risk of death from heart disease for adults with diabetes is higher than those who do not have diabetes. A common one is hypertension. So if it's uncontrolled, hypertension can affect your heart and other organs. It's a medical condition that happens when the pressure in the blood in your arteries and your other blood vessels are too high. And if it stays uncontrolled for a long period of time, for years, then it could also affect other parts of your body, such as your kidney and your brain. And hypertension is, you may hear commonly called the silent killer because it usually has no symptoms. It's the only way you would be able to detect it is if you are checking your blood pressure constantly and going to your physician and getting your yearly checkup, your annual checkup. And then there's chronic kidney disease. So hypertension can damage the blood vessels leading to the kidneys, and it'll cause damage over time. And then finally, a huge one is high cholesterol. So extra cholesterol can build up in the walls of your arteries, including ones of the heart. And high blood cholesterol also doesn't have any signs or symptoms. So the only way to know whether or not you have high cholesterol is to get your cholesterol checked, and you have to do that at your healthcare provider's office. So Vinny's going to talk to you about how we can kind of modify some of these risk factors. Go ahead, Vinny.
Yeah, so we just went over a bunch of, I guess, really scary disease states, but there are definitely things that you can do to help prevent and also kind of help your disease state as well if you do already have it. So some lifestyle modifications that we found via the heart.org. Some of the things you can do is stop smoking, choose good nutrition, obviously control your blood pressure. You want to be physically active every day if you possibly can. Aim for a healthy weight. You can look up the healthy weights through BMI charts, depending on it all varies based off of age and whatnot. And then manage your diabetes. Reducing stress helps a lot because stress definitely causes hypertension, and you probably don't even realize that it's happening. You also want to limit alcohol consumption and then control your cholesterol as well. So, as far as nutrition goes, there's a lot of guidelines that are pretty helpful. So, you definitely want to eat a variety of fresh, frozen, or even canned vegetables and fruits that don't really have too much of those sauces or added salt and sugars. So, you want to replace the high calorie foods with fruits and vegetables whenever possible. Definitely cutting back on sodas or beverages that or foods that are high in sugar and salt as well. Um, as far as grains go, you definitely want to choose more fiber rich whole grains that contain more grains per serving. And then for your proteins, you want to choose poultry and fish that don't have the skin on them, and then prepare them in a healthy way without any added saturated or trans fats. And if you do want to eat meat, you want to look for the leanest cuts available and then prepare them in a healthy way as well. So without the saturated and trans fats. And then eating a variety of fish at least twice a week, especially fish that are high in omega-3 fatty acids, such as salmon or trout, are really helpful. So for your fats, you definitely want to choose fat-free or skim milk, or even low fat, such as like 1% dairy products. You definitely want to avoid foods that have the partially hydrogenated vegetable oils to reduce the amount of trans fats in your diet, because those are obviously really bad. You want to limit the saturated and trans fats. Definitely replace them with better fats such as monounsaturated or polyunsaturated fats. Um, if you need to lower your blood cholesterol, reducing the saturated fats to no more than 5 to 6% of your total calories will help. So, an example of that is if you're eating around 2,000 calories a day, that's approximately 13 grams of saturated fat. But overall, you definitely want to choose foods that are lower in sodium, and then prepare your foods with little to no salt if possible. And then to lower your blood pressure, you definitely want to aim to eat no more than 2,300 milligrams of sodium a day. I know it's kind of hard to visualize, so we actually have an image coming up later. And then you definitely want to reduce your daily intake to around 1,500 milligrams, because that can definitely lower your blood pressure even more. Um, and then if you do want to drink alcohol, I know we all have like long days of work or school, and it's nice to have a drink afterwards, but you definitely want to drink in moderation. So for women, it's suggested that you drink no more than one drink per day. And then for men, it's no more than two per day. So here's just a visual of the sodium recommendations. So like I said, the recommendation is 2,300 milligrams a day or less, which you can see is equivalent to 1 teaspoon. So it's really not that much. So this is the DASH diet. It is a diet that is specifically recommended to prevent and control hypertension. It's fairly flexible, but it does suggest eating, low sodium, low fat dairy, um, and then it emphasizes vegetables and fruits and moderate amounts of whole grains, fish, poultry, and nuts. And it does cut out sweets a little bit, but it doesn't mean to cut it out completely. They just suggest you want to keep your sugar intake to around 5 servings or less a week. So, as far as exercise goes, the American Heart Association actually recommends 150 minutes or approximately 2.5 hours a week of moderate intensity exercise or 75 minutes per week of vigorous aerobic activity. So, moderate intensity pretty much means you are increasing your heart rate and your breathing rate, but you're still able to have a normal conversation while doing it. Some activities are, brisk walking, you want to bike, but a little bit slower, gardening, dancing, water aerobics. And then some examples of vigorous activity are running, swimming laps, biking at a much faster pace, and then jump roping. And, it's definitely hard to start off exercising. So, everyone really starts from somewhere. You just want to set a reachable goal for yourself. And then don't really get into that whole all or nothing mentality because that will definitely hinder your progress and staying with the exercise. So definitely any sort of movement is better than none. You can start by taking like a 10-minute walk a few times a day, and that will eventually add up. And then if you do have any sort of chronic conditions or disabilities, definitely want to talk to your healthcare provider about the appropriate types of exercise and even the amount of exercise that is right for you. So, smoking and alcohol definitely impact your risk for cardiovascular disease. So, cigarette smoking can actually damage the heart and the blood vessels. And then nicotine itself can also raise blood pressure without you really knowing it. So, you definitely want to start off by limiting your tobacco use and then eventually quitting if you can. And then, as far as alcohol consumption, drinking too much can raise your blood pressure and then essentially increase your risk for heart disease. So, like I said before, women are suggested to only have no more than one drink a day and then two drinks a day for men. So this is just a general summary of our recommendations. So things that you definitely want to do is cut back and limit unhealthy foods. So any foods high in sugar, salt, and fats are really good to cut back on. You want to start working out more. Usually using your small workouts throughout the week and adding them up until you are able to do more vigorous exercises. So you want to work up to that. And then modifying your daily eating by eating healthier foods that are better nutritiously for your body. Definitely want to check the nutrition labels. You want to check your fats, your sodium, maybe even calories if you're trying to cut back weight as well. And then talk to your primary care provider about any possible options as far as exercise or even dietary advice, and then if you possibly need medications as well. And if you already are on medications for, high cholesterol, high blood pressure, diabetes, it's really important that you take your medications consistently as prescribed. I know you can accidentally miss a dose or anything like that, but your pharmacist can definitely go over what to do if that situation does arise. But it's super important that you do take your medications consistently because that's the best way your medications will work. Um, Things that you don't want to do. So definitely don't overdo the exercises. That's kind of how you lose the motivation eventually. You want the exercising to be as sustainable as possible so you consistently do it every day. Definitely avoid eating lots of junk food, especially foods high in fat, sodium, and sugar. And then don't skip your medication doses. If you accidentally do it, that's totally fine. We're all human. But yeah, there's definitely ways um, to try and remember to take your medications every day. And that is it for our presentation. But if you do have any questions, I guess you can ask them now or even stop by our booth as well. And then we also have our email, our Instagram, and Facebook too.
Thank
Hi,
you. Hi.
I have a question about high cholesterol. They
Sure.
have me on a high cholesterol medication, but they also have me take CoQ10, 100 milligrams. And they said that has something to do with my heart to make sure because I'm taking the cholesterol pill that this pill will help to have no damage to my heart.
Hmm.
So is that what it's doing? The Q10?
Um, yeah. So CoQ10, the production basically in your body, it decreases as you age.
Uh-huh.
Um, and CoQ10 deficiency can lead to nutritional deficiencies and oxidative stress, and it kind of it helps with the like the cholesterol synthesis in your body. So yes, it would help with you.
Oh, it is good help for it.
Yeah,
Okay, thank you.
no problem.
Thanks for your question. Is there any other questions?
Vinny and I were also hoping that if we don't have any questions, then we would like to like take a picture with everyone if that's okay.
Oh, if they take their cameras off?
Yeah, if you turn on your cameras. You don't have to, but we were just wondering if everyone would be okay with it.
Yep, there's Dolores. Well, first, are there any other questions? There's Carol. Hi, Carol. Do I see any other of your smiling faces? I would love to see some of you too, actually. Greg. Hi, Greg.
Okay, I'm gonna take a quick picture. Alrighty, 1,
I love it.
2, 3. Thank you so much.
That's great. Thank you guys.
Yeah, no
Thanks,
problem.
Carol. Thanks, Greg. Perfect. Well, Chapman School of Pharmacy does have a booth here today. And if you do think of any questions, feel free to go directly to their booth to ask them. Just give me 1 second. I just want to make sure that there is no questions in a second area.
Vinny or Savannah, I sent put a chat in the chat box there. I don't know if you saw it or not.
Yeah, that's what I'm checking right now.
But I sent it directly to Vinny or Savannah though. You probably don't see it in yours.
Actually, you guys, I do have 3 questions for you.
Okay.
One is from, we'll start with Joseph. He says, I hear much about the keto diet. Exactly what does it do? What are the positives and negatives about it?
So I know for the keto diet, you essentially are increasing a lot the amount of not carbs, fats that you're eating. So it basically utilizes a different metabolic system within your body. So it basically sends your body into ketosis where you have so little glucose coming in that it uses your stored fats as energy instead. So that type of diet is I've seen to be pretty helpful for some people, but you are limiting your glucose a lot as well. So it all really just depends on the person. Yeah, it's if you can handle like a really, really high fat diet, then it could be helpful for you. I've seen a lot of people lose a lot of weight using the keto diet.
Thank you, Vinny. And Joseph had a follow-up question, which is, I hear that drinking a small glass of red wine helps the heart. True or false?
Everything is good in moderation. I can't say that I've seen any scientific studies on red wine actually helping the heart. That I would have to go and look into, but I'm not aware of any scientific studies on it. Craig also had a question that he sent to me, and he said, I've had an EKG and the interpretation said incomplete right bundle block, and he was told not to worry about it, but he wants to know what it means in lay terms and any potential issues it can lead to. Let me see. So a right bundle block. Okay, so your heart basically, it has electrical impulses that flow through and basically causes like heartbeats. And basically a bundle branch block is there's just a delay along the pathway of that electrical impulse to make that heartbeat. So it actually makes your heart it makes it a little harder for your heart to pump blood efficiently throughout your body. But from what I know, I think a lot of cases are kind of benign. So yeah, I think I wouldn't worry about it too much, but definitely keep an eye out and consistently go to your physician and always get it checked. So.
Thank you, Savannah. And I have Marva Murphy, who states she's 75. And during COVID, I started walking first thing in the morning with my heart pounding, not on any meds. I'm not sure. Marva, did you have a question in that, or was that just a statement you wanted to say? Let's see if she's still on. No? Marva? Oh, walking, waking. I started waking up. Oh, okay. So she said I started waking up first thing in the morning with my heart pounding. Oh, that's the question. I apologize. I read it incorrectly. So she wants to know during COVID, she started waking up first thing in the morning with her heart pounding, and she's not on any meds. Is there a reason why she would be waking up with her heart pounding?
Have you been diagnosed with COVID, or I think I'm a little confused by the question. You mean like during COVID?
No, I think she's just stating that it started during this period of COVID. She doesn't have the disease, COVID, but in the morning. So, you know, maybe it's due to stress. I'm not certain, but she's just saying when she wakes up now, her heart is pounding, but she's not on any medication.
Okay, I think this might be a case-by-case basis. There are multiple reasons that could occur, and if you haven't seen your primary care physician, I'd probably get a full evaluation on that. But yeah, I'm not sure. I'd have to take it by case-by-case basis. If you want to stop by our booth and kind of like talk it out with us, we'd be happy to do so.
Any other questions that we have?
Yes, I have one more.
Great questions. Yes, Dolores.
Yes. I want to know what this could be. I'll be laying after sleeping all night, and I wake up and I'm on my back, and I can't lay there too long because I get this wheezing sound in my chest, in my back. Well, I don't know if it's in my chest or in my back, but it's not shortness of breath or anything. It's just a wheezing sound. I've had it for a couple of years now, maybe 10 years, longer than that. And I wonder what could cause that. And I've had the tests done and everything. They couldn't find nothing, why that wheezing is in there. Are we there?
Okay, so you've seen your doctor and they couldn't find anything wrong with it? No, like inflammation or anything obstructing your pulmonary airway? Oh, sorry. I kind of asked that as a question, but
Dolores, she was asking that as a question. You've seen the doctor and the doctor said there was nothing. Okay. I'm assuming that, yes, that's correct, that the doctor did not find anything.
No, they didn't.
Okay.
Okay.
If there's no shortness of breath, usually that kind of thing may come from like chronic like obstructive pulmonary disease or like asthma, but you're also reporting no shortness of breath. That's
Right.
interesting. I'd have to look into that. I'm actually not that sure.
Okay.
Sorry.
Okay.
Any other questions? Let's make sure. I'm sorry, I have 3 screens that I'm looking at to add to see if there's questions. So excuse me when I turn my head. Okay, no. Let's see. I don't think we have any other questions. I don't see any unless you guys have any in your chat box. No. Okay. Well, Vinny and Savannah are at their virtual booth. Again, it's the Chapman University School of Pharmacy. You can feel free to reach them if you have any additional questions, and they have other information that I believe would be very helpful for you all. Very good. Okay.
Thank you, everyone. Have a good rest of your day.
Thank you all. Have a great day. And thank you, Savannah and Vinny, for the great presentation.
No problem.
Thanks.
Thank you.
Bye, everyone.